our guest Jamie here is a licensed therapist and a certified perinatal mental health clinician. And so, Jamie, with that, I'd love for you to introduce yourself to our audience.
Great. Hi, everyone. Thank you so much for having me. I'm so excited to be here. So as mentioned, I am a licensed clinical therapist and a certified perinatal mental health clinician. So what that means is I work with pregnant and postpartum women. I own a group practice called Nurture Therapy, which is located in the Chicago area. And our practice really helps women and their families throughout the reproductive journey. So we work with women who are starting to family plan, any fertility challenges. We work with grief and loss, and we work with any stressor or mood or anxiety disorder that comes up during pregnancy or in the first year postpartum.
Excellent. And I feel, especially during this last year, Jamie, that your services were more needed than ever. And so I'm really happy that you're able to share your skills today with our audience. So the way we're going to do this is just as a live Q&A. So I'll ask you a little bit about your journey, and then we're welcoming questions that pop in through the chat. So I'll be monitoring for everybody that joins. Go ahead and ask anything that you'd have of Jamie. And so first, I'd love to start and just hear a little bit more about your passion. Like, it takes a special individual to pursue this career, and what was the trigger for you to go into this field?
So I think I was born a therapist. Like, that's sort of, I think, what my friends and family would say. I was born a therapist. I actually think the more interesting journey is how I became a women's health and maternal mental health therapist. So I had been doing this work without really having a name for it. My first job was working as a case manager for pregnant and new moms. They were aging out of the child welfare system, and they were residents of a transitional living program. In order to be a part of that program, they had to have a significant mental illness or trauma history. Now I know that is an absolute recipe for a perinatal mood or anxiety disorder, which is the umbrella statement we use to describe any kind of mental health diagnosis during pregnancy or in the postpartum period. And these women were not being treated for this. We just didn't have the language or the knowledge back then that we do now. And so, as you mentioned, this has been such an important service, especially during a pandemic. But it's also been such an important service because we have the language and a little bit less stigma about getting help in motherhood. It's hard for a mom to ask for help, which is why I'm so glad clinicians like our practice exist. I was in a hospital setting doing inpatient OB social work, and I had a really wonderful mentor that introduced me to this world, and I have never looked back. I think part of what's so important about women's health and maternal mental health is that everything during pregnancy and in the postpartum period is treatable. And that's so important, I think, for moms and clients to keep in mind. Like, this is treatable.
Yeah, and it sounds like, thank you for sharing as well, that pivot that you made from working like in the hospital floor, doing case management, to really recognizing, your skill set and your passion applied in a very preventative way. And so how did Nurture Therapy kick off? Is it something that you just one day were like, okay, I'm leaving social work, or how did you make that transition?
So I opened Nurture Therapy in New York City, and I did not want to open my own practice, actually. I wanted to join another group practice. I didn't want to worry about keeping the lights on. And again, I think that this community is so supportive of one another. I'm always supportive of therapists, starting their own private practices. And I had someone who turned into be a really good friend encourage me to go off on my own. And so I did. And then we moved to Chicago, which is home, and I relaunched the practice. And I actually got pregnant with my daughter and was looking for someone to take over my maternity leave. So there was born a group practice model. And I think part of what makes Nurture Therapy so special, I see some of my clinicians on here, is that everyone's voice matters. whether you just joined the practice or you've been with me like throughout the long haul, I really want it to feel like theirs. And I think it shows. Um, it shows in the work that we do, how much we care for our clients' well-being, and just in the healing that goes on.
Absolutely. And it sounds like you have such a strong mission statement. Like you've really honed in treating these perinatal mood and anxiety disorders and bringing us like nurturing and bringing like healing and making it understood like this is totally treatable and you're not alone, and like really bringing that compassion through with all of the clinicians that you've onboarded. And so I would love to just hear from you. You know, a lot of our a lot of our research was done. So the natural nipple started from actually me studying the gut bacteria of preterm infants and really trying to figure out, one, how can we prevent preterm infants from dying from an imbalance of gut bacteria? But I was also interested in the long-term health benefits. You know, we know if we can help babies breastfeed for just 6 months, there's far less anxiety and depression later on in life. And we're really building this signature gut microbiome, but it's not easy. It's not I mean, you're a mom yourself, and so you can really bring a different level of empathy into your practice setting. But that's what we learned from the qualitative research across the U.S. is that 92% of parents just they feel these latching frustrations when introducing a standard bottle, which can complicate, you know, whatever hormonal imbalance. If you're already struggling with bonding with your baby, if you're already experiencing some postpartum depression, can feel almost like a rejection of your body. And so I would love to hear, like, you know, without you naming any of your clients, maybe some case studies of how you've helped people through their breastfeeding journey.
Absolutely. One of the things I think that comes up is that there's a lot of expectations that are placed on moms, especially around feeding. Um, some of the research that we have is that there's sort of an interesting association with nursing or pumping and perinatal depression or anxiety. So if a mom had really wanted to nurse and it's not going well, and she discontinues nursing, that hormonal change can actually increase things like depression or anxiety.
Yeah.
Sort of the opposite, if maybe nursing wasn't that important to them, they had sort of a more like laid back mindset or more flexible mindset, and they discontinued nursing, that change in hormones can actually decrease things like depression and anxiety. One of the things that's really important is we're meeting mom where she's at. We're not pushing one way or another. We think fed is best. One of the things that comes up in our practice a lot is, should a mom take medication if she is nursing or pumping? You know,
Yeah.
this, you know, what kind of exposure will baby have through breast milk of any kind of medication? So we're care of moms. And when we think about exposure, we don't just think about exposure to maybe a little bit of medication. We think about exposure with baby to mom's depression or anxiety, right? What kind of psychosocial or emotional things can that lead for babies and parenting? So we're definitely really careful. You know, our stance is always to be non-judgmental and really do what's best for the family. You know, best for mom and best for baby. We talked a little bit about our mission statement, and I will tell a quick story. I did so much work around the mission statement. We met as a group, we did activities. I mean, I was really like, how could I make this like perfect mission statement? Like, what do we do? How do we do it? But I kept going back to something that I had put in a letter to a doctor when I first opened the practice. And it was just this small line that said, healthy moms raise healthy babies. And I kept going back to that. And it was so simple. And our mission statement, we just sort of changed it to healthy and happy moms raise healthy and happy babies.
Yeah, 100%. Like, bottom line, and if you can support and really meet people exactly where they're at, and remember that everyone's journey is so unique. You know, you may have had this roadmap set out for you, and of course you're trying to do the best thing possible for your child, when it comes to feeding and really like achieve those World Health Organization's goals of breastfeeding. But the reality is the quality of your milk is so much better. The immune proteins that you're passing on to your baby are so effective, even if you can get a little bit of pump milk in. And so it's not like a one or the other situation. If you can like take a break, and if you can give your body that rest that you need, if you can schedule a meeting with your therapist, if you can take a walk outside, if you can just change your paradigm of what that journey looks like for you and sort of embrace where you're at, it's more than good enough, right? And so that's why I really love your mission statement, because it's very much like when you travel and they're like, put on your oxygen mask first.
Yeah. No, I do that example all the time. So before I was a parent, I would say something to my clients, something along the lines of, you have to take care of yourself before you can take care of everyone else. And I'm really lucky my clients came back after I said something like that. And while I absolutely believe it in theory, it is so hard in practice to take care of yourself as a new mom. And I use that exact example. When you're traveling or on an airplane, what the first announcement they make is, in the event of an emergency, put on your oxygen mask before you put on anyone else's. And again, like, we're smart women, like, we get that, right? I get that in theory. In practice, I'm putting everyone else's oxygen mask on before I put my own on. And then I'm passing out and being of no use to anybody.
It's usually how it goes.
Totally how that goes, right? So I'm thinking, what can we do for our moms to prevent them from passing out, right? Like, that's what we need to do. And it is so hard. And we have just such a talented, clinically sound group of women. It's an all women's practice that really, help moms figure out how they can take care of themselves while they're taking care of their babies.
I love that. And, you can tell that your mission statement, like the amount of work that you've put into it and the people that you've onboarded in your practice, like just from the comments we have in the chat from people joining, it's making a difference. And so, yeah, I just wanted to address as well, like so our vision and mission is very synergistic. We want to empower new parents. We want to promote bonding, and we really want to break this dichotomy of, exclusively breastfeeding only is the way, or exclusively formula only. We really want to meet you exactly where you're at. And if a product is causing your latching frustration and your difficulty bonding with baby, like, let's make a better product modeled after breast. But we realize there's a bigger overarching umbrella of lack of psychosocial support in the United States. So aside from the hardware solution, our goal was to also, provide access to telehealth services. So with every bottle purchased, you can get a primary care visit. So we really do triage holistically, as if you were going to the doctor, like ask you your medical history, because maybe you think, okay, perhaps I have milk supply deficiency, and then oh, actually, you've got uncontrolled diabetes that's impacting your ability to make milk. Or perhaps we get to the root of this, and it's just, I just don't feel like I have anyone that I can talk to. And that's in this case where we would refer to someone like you, Jamie, because I think the good thing about the pandemic, and you can correct me if you see something different on the East Coast, is it's become much more normalized to reach out to a therapist. And yeah, and like, we're realizing now with a lot of the world transitioning to telehealth and to remote Zoom meetings and remote work, that you're accessible, like you're able to be in home, like right when those feelings are happening. And so can you walk us through a little bit of your process and like the scheduling and how you onboard new patients as well?
Absolutely. So I think you're absolutely right that, I wouldn't wish a global pandemic on anyone. And that this has really shined a light on mental illness. Even that social workers and clinicians were considered essential workers, I think really shows how important mental health is. Not only that it's more accessible, because people can just sign on, it's like another Zoom meeting, and be in a teletherapy session with their therapist. It just, there's a need that everyone, it's okay to need a little extra support, right? So I think accessibility in this case, like, really is all encompassing. There are some limitations with teletherapy in that clinicians can only treat clients in states that they are licensed in, and that's where the client is sitting. So that's something that not everyone knows about teletherapy. So even though I'm in Chicago, I actually happen to be licensed in New York as well, but someone in Texas wouldn't be able to utilize my services.
Right.
Hopefully that gets changed, but we'll see. So if a new client reaches out, I actually do all the initial phone calls. Nurture Therapy offers a 15-minute complimentary phone consultation. That was really important to me because, again, I wanted to reduce some of the stigma around mental health or moms seeking help. I also wanted to provide good resources. So one of the things I offer is that if my practice isn't the right support for someone, I will help them find resources and other referrals, even outside of my practice. So I do an initial evaluation, and then from there, I add them to one of my therapist schedules, sort of depending on need and focus. Again, the clinicians sort of have different focuses within this area of maternal mental health. I feel so lucky. We've really been able to grow the practice based on everyone's passion and interests. So that's a little bit how it works. I don't believe in wait lists, so we really try and get moms in as quickly as possible. It's hard to say to a new mom, great, we can see you in 3 weeks. By 3 weeks, one, that's too long to wait if you're depressed or anxious and you're a new mom. But by 3 weeks, you have a totally different baby. So we really try and get our clients in right away. And that's something I've definitely prided myself in during this pandemic, where practices are busy and people need more help than ever.
100%. And what was, if you could share maybe some of the common themes that were coming up, this last year, and even now, like, as the world is changing a little bit from what became our new normal, what are some of the common themes that you hear new moms bringing up?
One of the most common things I hear is just how overwhelmed moms feel, the emotional burden or mental overload that moms take on. So for example, even if there was a dual income household, a lot of the responsibility still fell on mom. Right? To do e-learning, to provide childcare, to have a screaming baby in the background of a work call. And I think that there's something about that just is not workable anymore, right? We got to change that. Especially if, there's not access to childcare, or there isn't the same help and support that there was pre-pandemic.
Right.
So that's one of the things that's come up that's been really frustrating. These sort of stereotypical gender roles, for example, that maybe it's the first time in your relationship that you've experienced. So that's been one of the themes that's come up. And there's been a lot of anxiety around keeping families safe, around COVID, around what that looks like.
Yeah. And I mean, I can definitely share, just from personal experience, may not be perinatal, but there's so many changes going on as well in the workplace and navigating, the path forward. Like, you're a founder yourself. So trying to, navigate essentially all that uncertainty that is just emphasized right now, like when there is a lot of changes in sort of like company structure, what the path forward to launch looks like. And so being able to chat with somebody, like you're saying, where you're really prioritizing and you understand, like, for a new mom, 3 weeks is too long to wait. You're also just there to say, like, hey, like, I'm here for you. I hear you. This is okay, what you're feeling. You can, embrace this together. And also, like you said, an excellent thing that you're able to do is really provide resources for where parents are. And I think beyond listening, that put something into action. Like, okay, this is the community that you live in. Here are some, childcare options that we found, or like some going back to workplace support programs that we found. And so really being able to curate the care for your client, I think, is so important. Um, you know, I'll just say this. I think it's hard, especially if financially you're struggling, to justify saying, I am putting me first, and this is a worthwhile service that is going to have far greater ROI for my health, happiness, and family's happiness. So what do you say to, somebody that is struggling financially, and like, what does your model look like? Do you accept insurance, or if it's pay for service, how do you work with somebody where they're at?
I think there's sort of two parts to that question. So we do accept insurance.
Yeah.
I that taking care of your own mental health shouldn't be a financial burden on you or your family. So in the Chicago area, Illinois is a big insurance state. So most clinicians accept insurance. It looks really different in New York. Most clinicians don't take any insurance. There are always options. So most therapists will provide what's called super bills or reimbursements, where clients can submit those paperwork to their insurance carrier directly. I always encourage folks to ask about that. The other part is, I think what you're kind of getting at is, it's really hard to have a new mom go into therapy, right? You're exhausted, you're overwhelmed. All your kind of disposable income is going to this new baby who's growing out of clothes every few weeks, right? It's really hard to take care of yourself in the similar way of, our oxygen mask example. And so, to those moms, I say, yeah, we get it. And if your symptoms are severe enough, if you're not functioning, then you do need treatment or extra support. That doesn't have to be therapy, but it has to be something. So our goal is really to get moms to feel like themselves and as quickly as possible. Right? We want moms functioning. We want, again, happy and healthy moms to raise happy and healthy babies. Just think about what that would do for the world if babies were in these healthy, happy mother-child dyads.
100%. And especially, where I think some family structures have changed, like we're going back to multi-generational households perhaps, or single family households look a little bit different. Really creating that community for yourself is something so primitive and ingrained in our DNA. And we're just looking at a different way of doing that, right, in today's society. Thank you so much for that comment as well, GH. She said, you'd be surprised my insurance is completely covering my therapy in Illinois. So I would say definitely, you're offering this consult, you're offering this 15-minute call. Might as well just explore your options and see if you can be 10% more supported. And not to feel, I would go back to the data alone and needing to reach out and speak to someone. So we surveyed nationally to see what these barriers to breastfeeding were. I mentioned the physical problem was this latching related to shape, feel, and flow of standard bottles. The psychosocial issue, it actually increased to 96% of parents just felt that they didn't have the support they needed during COVID. So that's from a healthcare provider or from the community. And so that's an overwhelming number. That's an overwhelming percentage. But just to sort of take that and realize, okay, this is just a part of the human experience right now, but what are my options and what can I do to move forward and to really support myself and my family to thrive? So with that, Jamie, I was just wondering if you could talk a little bit about, it can be anecdotal, just some of the benefits that you've noticed from your services to your clients.
Sure. I think you're absolutely right. The saying, it takes a village. It really does take a community. And I think cultures who have this community support, where family members rally around new mothers, have less instances of depression or anxiety. were a very sort of independent, self-sufficient country, and so that complicates the postpartum experience. One of the things that complicates it too is there isn't that same sense of community, and especially at the height of COVID, moms weren't going out, they weren't in play groups. What I did see, and in addition to our therapy services, which I'll talk about in a moment, was that moms and organizations got really creative. So there were virtual support groups, not the same, but there were virtual support groups that could be really helpful. I joined a virtual play group with my toddler. I was like, we got to do something. Do you think the connection with your therapist was also really powerful? Just this idea that you're not alone, your experience is real and valid, and here's someone who can mirror that for you and really help you to heal and recover. There's so many benefits of therapy. But one is that you're partnering with your clinician to meet your therapeutic goals. And that is really powerful, to not do something alone.
Yeah.
Are relational beings. And I think, at the heart of therapy is a therapeutic relationship.
Absolutely. And I love that you touched on partnering to meet therapeutic goals. And you also touched on other societies and sort of what we are lacking in the West is this sense of gathering around a new mom. And if I could share, I was so curious once we got this data from Breaking Barriers to Breastfeeding in the United States. And I was like, okay, well, what are other countries that are, breastfeeding for longer, reaching that goal of 6 months and up to 2 years, doing differently? And Nepal was actually doing the best in the whole world. And so, I was hypothesizing, I'm like, well, maybe it's socioeconomic status. There's just not enough money to buy bottles or formula. But there's other countries that are far poorer that have rates that are not anywhere near as good as Nepal's. So I went and I replicated the same exact research. And what I found was so interesting. So within the community, it's just a part of the norm of the culture that your neighbor, if you're a new mom, comes, will bring food for the first 3 months. If you don't have a partner, that you're going to their parents' house for the first month, and then you would go stay at your parents' house for the second month. And they're really just rallying around you because they recognize how difficult this transition can be into motherhood, into bringing a new life into the world. And you're actually being doted and waited on with really nutrient dense foods like congee with Ajuan, which is like a seed that has a lot of omega-6s. And so I think this is our way of bringing some of that back in the West. It's like this telehealth service of the support that you need in home, and just cultivating a sense of community, and here and
Yeah.
now.
And, to your point, how different would, maternity leave look like? One, if we had, federal maternity leave, right? Or if you early postpartum experience was just about feeding and bonding with baby.
Yeah, that's all you worry about. That's it.
It's, again, I think that there's a lot of cultures that for moms' mental health and healing and recovery just, have the right idea.
Absolutely. And I appreciate what you're doing, for new moms in today's day and age, especially just because of what the data says. And, I'm so excited to know that, you're providing services in Chicago, and it looks like you're expanding as well, right?
So I'm very excited to share that we are expanding to Minnesota and to Tennessee.
Awesome. Okay, great. So for anybody listening who has pre-ordered the Natural Nipple, so just to go back, what that is, it's an infant feeding system that for the first time is designed after real mom's shape. So we've 3D scanned women's breasts to create a latch match that's matching your unique nipple geometry when you take our survey on the site, kind of like a Warby Parker face shape survey. But more importantly, we've actually studied lactation averages over the first year to create a data-driven system. So every 2.5 months, you are meeting those growing feeding demands of your baby. And the idea is seamless, stress-free breast to bottle feeding. If you need that break, if you want to sleep through the night and have your partner help with feeding pumped milk, or you're going back to work and you're introducing a product, you're not going to struggle with that latching frustration. So far, 100% of our beta testers have actually reported that they have reduced latching frustration compared to other products and reduced colic. But importantly, I really wanted to bring that healthcare aspect into your home. So we'll be partnering with clinicians like Jamie. If you fill out our triage form and we see, the root of your problem is maybe you just need someone to talk to. And so I'm so happy to hear that you're expanding, beyond Chicago. So Tennessee, Minnesota, soon to come. Before we close, is there anything else you wanted to touch on about nurture therapy, Jamie? And how can our listeners find you?
Absolutely. So a lot of people ask me, like, how do I know when I need therapy? And I have a really simple explanation for this. And it's just to look at functioning. So every new mom worries, right? I like to make this sort of insight, like every new mom is going to check to make sure their baby is breathing in the middle of the night, like you just are. What makes sort of new mom worry different from anxiety is functioning. So is that new mom, checking on her baby maybe once, twice in the middle of the night and rolling over and going back to sleep? Or is she up all night, on the hour, every hour, making sure that that baby is breathing? Not sleeping is not functioning. Functioning looks different for everybody. So if you're not functioning, I think that's a really simple way to reach out to someone like me, another clinician. There's so many resources for moms and maternal mental health out there. There's absolutely no shame in needing a little bit of extra support, right? Like I said at the beginning, everything in the perinatal period, pregnancy and postpartum, is treatable. So how folks can find me is our website, www.nurture-therapy.com. You can reach me by email, hello@nurture-therapy.com. You can follow us on Instagram for some free content. We have a form directly on our website where you can also do a new submission form, and I reach out to all of those folks.
Awesome. Well, it was such a pleasure having you today, Jamie, and I'm really excited to be able to refer our customers and our patients to your services as well.